Hello everyone. We will be learning about mammography. So let us begin with breast anatomy. Breast, as we know, it is the most important structure which is present in the pectoral region. Now, breast is found in both the sexes, but it is rudimentary in males. In females, it provides nutrition to the newborn in the form of milk. Now coming to the situation and extent of the breast, as you can see in this picture, the breast lies in the superficial fascia of the pectoral region. Talking about the extent, it extends vertically from second rib to the sixth rib, and horizontally it extends from the lateral border of the sternum to the mid-axillary line. Here you can see tail of Spence. This axillary tail of Spence lies in the axilla. Now this is of importance because most of the breast cancers can develop in this region, even though it is not fully included in the breast tissue. Now coming to the structure of the breast. So the breast of the mammary gland is lined superficially by skin. Here you can see a conical projection which is called as nipple. And nipple is pierced by 15 to 20 lactiferous ducts. The skin which is surrounding the nipple is called as areola. So in this sagittal section of the breast tissue, you can see ribs, the intercostal muscles, this is the pectoralis major muscle, and this is the stroma of the breast. Now stroma can be partly fibrous and partly fatty. So the fibrous stroma will form a septa which is known as suspensory ligament of Cooper, whose function is to anchor the skin and gland to the pectoral fascia. The fatty stroma will form the main bulk of the gland. Here there are lobules which contain the alveoli. Now each lobule is drained by the lactiferous duct. All the lactiferous duct will converge towards nipple. Near the termination of these ducts, you can see a dilatation over here which is called as lactiferous sinus. Here you have your first question. What is the function of suspensory ligament of Cooper? Now coming to the radiological anatomy of the breast tissue, you have your two views, that is CC view, craniocaudal view, and mediolateral oblique view. So here you can see intercostal muscle. This is the pectoralis muscle. This is the glandular tissue of the breast. Here you can see nipple, and the skin which is surrounding the nipple is called as areola. Now here you have lactiferous ducts. This is the subcutaneous fat. This outer layer of the breast is called as skin. And this is the retromammary fat. Now we will see some major lymph nodes of the breast. So axillary lymph nodes are the ones which are the main group of breast lymphatic drainage, and consequently they are the main location for metastasis. So here we can see the anterior weave of the breast. The majority of the lymph nodes that drain the female breast are located in this region over here which is called as axilla. So we will first see some axillary lymph nodes. Here we have apical axillary lymph nodes. This is the central axillary lymph nodes. This is the brachial axillary lymph nodes. These are the subscapular axillary lymph nodes. These are the pectoral axillary lymph nodes. These are the interpectoral axillary lymph nodes. And besides that, we also have parasternal lymph nodes, paramammary lymph nodes, and submammary lymph nodes. Now in breast cancer, the cancer cells which are there are more likely to reach the lymph nodes which are closest to the affected breast. So once it reaches the lymphatic system, cancer cells has greater potential to travel to other parts of the body and has to be treated more aggressively. Here you have your second question. Which group of lymph nodes are the main location for breast cancer metastasis? The next topic that you'll be learning is conventional mammography equipment.